How should multiple myeloma MM patients drink water? Encouraging fluid intake in multiple myeloma is essential, especially due to the complications that arise from the disease, such as hypercalcemia, renal impairment, and light chain cast nephropathy, myeloma kidney. Why encourage fluid intake? And light prevents dehydration since dehydration can worsen hypercalcemia and kidney function. Flushes toxins. Adequate hydration helps eliminate free light chains and prevent their deposition in renal tubules. Reduces hypercalcemia since enhances renal calcium excretion by increasing urine output. Promotes kidney function, protects against renal damage from paraproteins, hyperuricemia, and hypercalcemia. Recommended fluid intake. Goal: 2 to 3 liters per day, as tolerated, unless contraindicated by conditions like heart failure or significant renal dysfunction. Fluids should primarily consist of water. Other options include oral rehydration solutions if needed. Clear, non-caffeinated fluids like herbal teas or diluted juices. Guidance for patients. Monitor fluid intake. Keep a log to ensure adequate daily consumption. Use visual cues, such as filling water bottles, to track progress. Recognize fluid intolerance. Stop if nausea, bloating, or discomfort occurs. Contact a healthcare provider if fluid intake leads to worsening symptoms, e.g., swelling or difficulty breathing. Balance intake with medical needs. Adjust intake based on doctor recommendations, especially in patients with cardiac or renal comorbidities. Avoid excessive intake to prevent fluid overload. Tips to encourage hydration. Sip water throughout the day rather than drinking large amounts at once. Flavor water with lemon or cucumber for variety. Set reminders or use apps to stay on track. Incorporate hydrating foods, e.g., soups, fruits like watermelon. When to limit fluid intake. Fluid restriction may be necessary if the patient has advanced heart failure. Severe renal failure leads to oliguria or anuria. There is evidence of fluid overload, e.g., pulmonary edema.